Lymphedema or swelling in the arm is common after breast cancer surgery and radiation. Sometimes the swelling is temporary and goes away once someone is done healing, but for others, the swelling can be lymphedema, which can last long term. My name is Kelly, and I'm a physical therapist that specializes in lymphedema as well as oncology rehab. And today in this video, I'm going to explain how to treat and reduce arm swelling and lymphedema. Before we begin, make sure that you subscribe down below for weekly new videos. You can also join us on Instagram for more related content, and you can check out our website for more resources. So there are 4 main treatment options to manage arm lymphedema, along with a handful of other methods including surgery, kinesiotape, and deep breathing. Now, I'm going to go through a few in a moment, but if you're looking for more options and want to go more in depth of each of these techniques with step-by-step guidance, then you want to check out my breast cancer rehab program. As an oncology physical therapist and lymphedema therapist, I work with individuals daily who have arm lymphedema and want to share my expertise with everyone. So in this program, there are different modules that someone can learn at their own pace, and they can start right at the time of diagnosis and all the way through treatment and years later. They will help you recover quickly and return to your hobbies and activities that you love to do. We go through lymphedema, shoulder motion, exercises, and more, and someone can pick and choose from which pieces of the program that they might need, or they can get access to the entire program. Whatever fits. So you can get more information on this on my website, which I will link down in the description box down below, or as well as up above. But now let's move on to the main ways to treat arm lymphedema. So the first way is with manual lymphatic drainage, or MLD. This can be done a few times a week or even daily. Lymphatic drainage is a massage-like technique that is done in a specific sequence with a special technique to move fluid out of that congested arm to help reduce the fluid or the edema. This will also help improve someone's skin texture and help to avoid infections. A certified lymphedema therapist can perform this, but it may be something you need to learn long-term, and learning how to do it yourself at home can be really beneficial. Another way to treat arm lymphedema is with compression. Compression in phase 1 treatment is done with compression bandaging to reduce volumes of lymphedema and swelling. And compression garments are used in phase 2 of compression treatment. Compression therapy involves wearing the special garments such as compression sleeves, gloves, gauntlets that apply pressure in a gentle way to that arm or affected area. This gentle compression helps to reduce swelling and improve circulation. Compression garments are considered maintenance garments, as their goal is to help manage and maintain a reduced size of fluid after someone has used compression bandaging to do the work to bring the fluid down. If someone tries to go into a compression garment right away and they have more moderate or severe lymphedema, or maybe thickened, hardened tissue that's fibrosis, then these garments or sleeves are not going to be as effective to get that fluid down. It's really also important that sleeves and garments are measured and fitted correctly to someone. Not only can these be very difficult to get on if they don't fit well, but if they're too tight, they can cause a tourniquet and be painful and possibly make the swelling even worse. If they are too loose, then they may also just not be effective and not work. A third way to help reduce and manage lymphedema in the arm is with exercise. We know that the muscles in the body act as a pump to the lymphatic system, and this can help work to move fluid out of an area that's congested. Exercise is best done with a compression garment or compression bandaging worn to be the most effective. So you have the compression from the outside with the pump on the inside working together. That's going to get the fluid moving up and out of that arm. But any exercise is great. I personally encourage someone to pick something that they love to do, because then they can stay consistent with it to make it more of a routine to help with that lymphedema or that swelling long term. The only risk of making lymphedema worse with exercise is overdoing it, especially really or right away. So this means we want to start slow and low. So if someone's not used to exercising, starting with just 10 minutes or less, and then gradually building up a few minutes a week to your desired time is the best way to go. You also want to avoid heavy resistance or weights if someone is new to exercise. So starting with no resistance, no weights, doing exercises with maybe 1 pound of dumbbells, and then building up 1 to 2 pounds a week is also a really safe and great way to go about it. By progressing nice and slow, we can help minimize the risk of muscle soreness. And what is muscle soreness? Well, simply put, inflammation and swelling occur inside the muscles. And we don't need a reason to move more fluid to that arm or that area and worsen that lymphedema. And then another way to improve arm lymphedema or arm swelling is with skincare. So taking care of the skin is the last treatment option I'm going to talk about in this video. So when an injury or an opening in the skin occurs, bacteria and viruses can enter the skin quickly and into the body, causing an increased risk for illness or infection. It's important to know that infections and lymphedema are closely connected. Having increased blood and lymphatic fluid in an area with the swelling increases the risk of someone getting an infection in their body. And having an infection or getting an infection also, vice versa, increases someone's risk of developing lymphedema if they don't already have it. So if an individual has lymphedema, taking care of the skin is the first form of defense when it comes to avoiding infections. And again, if we want to try to avoid lymphedema, we want to make sure that we're taking care of the skin. So those are the 4 main treatment options for lymphedema of the arm. Like I mentioned, I go much more in depth of each of these, along with others like kinesiology tape, pneumatic compression pumps, talk about surgeries, showing hands-on techniques and demonstrations in my breast cancer rehab program. So to learn more, you can check out the link in the description box down ahead, or I'll link it up above as well. Otherwise, I hope you all found this video helpful, and we'll see you all in the next video. Thanks, everyone.